ABC 10 News at 4 starts now.
The roller coaster continues for San Diego County restaurants.
We're going into purple here, and now it's no indoor dining again, and it's to say it's frustrating is an understatement.
They're having to make major changes that could jeopardize business yet again. Good evening, I'm Kimberly Hunt, and this is all because our county will now move into the most restrictive coronavirus tier on Saturday. ABC 10 News reporter John Horn explains why this time around will be especially challenging.
Breakfast Republic in the East Village just installed this covered patio, giving the restaurant an extra 30 seats protected from the rain.
But that doesn't help us if it's windy. That doesn't help us if it's freezing cold, even if we put out propane heaters.
Owner Johan Engman says the winter weather will make this next phase of the coronavirus era especially challenging. That inflamed by the fact that come Saturday, restaurants across the county will no longer be able to serve indoors as San Diego County enters the purple tier of coronavirus restrictions to combat increased spread.
If every single person that shows up before 9 a.m. wants to sit inside and they opt to not dine with us, that's a pretty big number if we lose everybody.
Engman's restaurant group, Rise and Shine, has spent tens of thousands of dollars outfitting its interiors for social distancing. Those investments now moot for at least the next 3 weeks. Meanwhile, staff hours are likely to be cut as capacity goes down. Overall, jobs in county restaurants down 17% compared to this time last year.
I don't make the rules. I try to follow them, but I think to shut down the restaurants again is not a good thing.
Engman declined to say just how much the pandemic has impacted his restaurant group's bottom line, but he did say it's not where they were in 2019.
If it was 100%, you wouldn't see this.
The restrictions take effect at midnight Saturday morning. John Horn, ABC 10 News.
Devastating for so many businesses, and the state says 106,000 San Diegans work in restaurants. Coming up on ABC 10 News at 6 o'clock, we speak to a local restaurant owner who says he'll defy the order limiting service to outside.
Texas is now the first state with more than 1 million confirmed COVID-19 cases. This is according to new data from Johns Hopkins University. The state had nearly 11,000 cases on Tuesday. That was a new daily record. El Paso is one place being hit especially hard. 1 in every 30 people there actively has COVID-19 based on the number of active cases in the population. That test positivity rate has been at 20% or higher since before Halloween. The city has 6 mobile morgues currently in operation, and leaders say more are on the way to try to keep up with the number of deaths. That includes Daniel Morales, a 39-year-old nurse who fought COVID for weeks before he died.
I always have a positive nature where he's going to be fine. He's just fighting this thing off. He's fighting it. He'll be fine. And he never recovered.
Recently, an El Paso County judge instituted a shutdown of non-essential businesses. The state calls the judge's move illegal and is pushing for other mitigation strategies. Pharmaceutical company Eli Lilly plans on distributing a treatment for coronavirus patients this week. The FDA just gave the green light. The antibody treatment is for patients over the age of 65 who have mild to moderate symptoms. Patients who are 12 years and up are also eligible if they have underlying health condition. The FDA's approval comes at a time when cases are going up again and hospitals are struggling to treat so many patients. Infectious disease experts say one of the biggest challenges for hospitals right now is to figure out where they want to administer the treatment. It's given through an IV, and usually IV treatments are given in an outpatient setting to cancer patients.
If you're talking about hospitals that really have infusion centers for cancer chemotherapy, that's not generally a place where they're going to be very comfortable taking COVID patients in the contagious phase of their disease because they also have highly immunocompromised patients there.
Some hospitals in the U.S. already have the resources and space to administer the treatment to COVID patients, but many still don't. Another option would be to administer it in an ER while still following the same criteria for who receives it. While there are guidelines for who receives it, cases are rising, and that could add another limitation to how many patients get the new antibody treatment.
And then, of course, how are patients referred to that facility? Will doctors know about that? And defining exactly which patients will benefit from this is also somewhat up in the air.
Health and Human Services will be responsible for distributing the treatment. It will focus on states where hospitalizations and overall cases are high.
A pilot was taken to the hospital for minor injuries after making a hard landing at Fallbrook Airport. Officials tell us the small plane had engine trouble this morning when it touched down. The pilot landed just fine, but ran out of the runway and kept going another 50 feet. It was the only person on board and was taken to Palomar Medical Center for treatment. Our ABC 10 News breaking news tracker was there as a man led police on a 45-minute chase through parts of San Diego. Police say it started when they got a report of a man in distress near Hoover High School about 12:15. When officers approached, they say the man drove off. The driver took police down University Avenue, through Hillcrest and parts of downtown, driving through multiple spike strips. He ended up pulling into the car rental center at Lindbergh Field, where he ran off and was later taken into custody.
There's a new way to do contact tracing in the works, and it could make a difference for healthcare providers during flu season. Vibrant Health just got a contract with major health institutions to develop the platform. Part of the idea is for users to enter their symptoms and find out if they're more likely to have the flu or COVID-19.
Healthcare facilities do get bombarded with perhaps people thinking that they have COVID when they just had flu. So the idea is, how do you help the healthcare organizations to reduce some of the burden?
The technology is designed to be embedded in other apps that organizations and institutions already use, like a university application for students.
So make it easy for people and don't try to change their behavior. They are already using certain applications that this can become a part of.
The app uses Wi-Fi networks to find out if you may have been close to someone with the virus. It could help cut some contact tracing work for the public health departments. Instead of calling everyone that may have come in contact with the virus, the app can report that information.
There's only so many people, so many human beings, so many people that public health departments can hire to do that contact tracing. So technology becomes really important.
The development is still in its early stages. Right now, the focus is on fine-tuning the algorithms to evolve along with changing data on the coronavirus. Broader testing is expected in the first few months of 2021. There's new guidance on masks. The CDC now says wearing one can help protect you from getting the coronavirus. The agency previously said the main benefit of masks was to keep infected people from spreading the virus. The CDC cited several studies that found masks can reduce your risk by more than 70%. Adding universal mask policies could help us avoid future lockdowns. Nursing homes are still taking days to get COVID test results back. A Kaiser Health News analysis finds about 38% of nursing homes have yet to use point-of-care tests. They can be given on site and detect the virus within minutes. Federal officials started distributing those to nursing homes in late summer. The Department of Health and Human Services plans to send out about 23 million rapid tests by January.
Tributes to our veterans are taking on different forms today because of COVID. In Kearney Mesa, people jumped in their cars for a drive-through salute to the men and women who've served our country.
Thank you for your service. Happy Veterans Day!
The parade is hosted by Honor Flight San Diego. At the end of the route, every military veteran receives a care package.
We weren't sure how many we're going to get. We're going to get 1 or 1,000, and looks like we're going to creep up on that 1,000.
It's something you don't forget. You live with it. But there's so many. I'm just proud of the military today.
And we are proud of all of you. Operation Gratitude donated the items for 1,000 care packages, and Honor Flight San Diego collected more than 3,000 letters from supporters around the country to say thank you to our veterans for their service.